Okay. I'm Dr. Elizabeth Vaughan. Thank you so much for coming. How many of you read the article in Natural Triad or saw it online? Hands. So some of you have not read it. Did you hear about it on Fox 8 or? Yes. Great. Wonderful. So someone is up at that time of the morning. This is the second in a series that I'm doing. I was hoping to get out a article on estrogen for October, since October is breast cancer month, et cetera, et cetera. There's so much controversy about that. But I realized as I was writing the article that I needed a whole lot more documentation, because of all these 3 articles on female sex hormones, that's going to be the most controversial, and it's going to be the most different from what conventional doctors tell you. So you'll have to come back in November to hear me talk about estrogen, and also to read the article in Natural Triad in November. I realized I wasn't ready to publish it in October. But tonight we're going to talk about testosterone, and this will definitely have some PG-13 components to it, because we're talking about testosterone and how it affects all of our bodies. So let me go back. But this is the blog. I've been doing this since December of 2011. So there's lots of information here. And let me go back. Okay, so that's just an image for you. Oops, come on, baby kids. Come on. There you go. All right. Testosterone is just as much a women's hormone as estrogen is. In fact, we would not have estrogen if we didn't have lots of testosterone. We have about 10 times more testosterone floating around in our bodies than we have estrogen, because testosterone is the chemical, the hormone from which we make estrogen. So women have to have a lot of testosterone. Now, we don't see the full effects of that, partly because our levels of testosterone are so much less than men's. All right? But the other reason we don't see the effect is that estrogen is so incredibly powerful. It is such a strong hormone. So it's not just the amount of the hormone that you have in the blood, it's also how strong is it. So that's why we don't see that effect of testosterone in our bodies. Also, testosterone and estrogen does not float around uncontrolled. All right, the body has a very good way of controlling how much testosterone and how much estrogen you see. And what is used, welcome sir, I'm so glad we have another guy, welcome. Testosterone and estrogen are kind of carried around on barges, okay, called sex hormone binding globulins. So it's a great, big, bulky protein. And it has testosterone and estrogen and not so much progesterone. It has DHEA on it and things like that. So that if you have a lot of sex hormone binding globulin in your blood, and I'll come back to what causes that, then the amount of estrogen and testosterone that you have floating around free off of the sex hormone binding globulin is relatively low. Okay? If you don't have much SHBG, sex hormone binding globulin, then there's more testosterone and there's more estrogen. Okay? Now, that's important because probably every single one of you either took birth control pills or you know someone on birth control pills. And birth control pills give you a very, very strong chemical estrogen. And you swallow it for the most part. All right. Premarin is not a strong, welcome. Premarin is not a chemical estrogen. It is a horse estrogen. So in our body, it's not a bioidentical hormone, but it is a strong estrogen. And Premarin, for the most part, we swallow. And in the Women's Health Initiative, that was stopped back in 2002, because women who are on Premarin and Prempro, which is a progestin, which is another drug, all of these were drugs in our bodies. When women swallow that, clots, heart attacks, strokes, And they also had an increased risk of breast cancer. And if you think about it, well, gee, those are the same complications that women get when they take birth control pills. And that's because they were swallowing these chemical estrogens, these pharmaceutical estrogens, or they were swallowing Premarin, which are horse estrogens. Now, if you swallow a bioidentical estrogen, it will also increase your tendency to clot and have strokes, etc. If you swallow a bioidentical testosterone, which you won't find on the market, okay, it will also increase your tendency to clot and have a heart attack. Mother Nature did not design our bodies to swallow hormones. So whatever you do in terms of hormones, you want to try to deliver it the same way the body did when our ovaries were functioning optimally, either when you were not taking birth control pills or before you were menopausal, or if you still had ovaries, if your ovaries got taken out. And that's, you have to apply it to your skin. And that way it goes into your bloodstream, directly into your bloodstream the same way it did when the hormones were released from your ovaries. Are you following me? Mm-hmm. Okay. So you don't swallow hormones. It's a recipe for disaster with respect to your cardiovascular system. So that's true of estrogen and testosterone. You can swallow progesterone as it works out, but certainly for estrogen and progesterone, estrogen and testosterone, you have to apply them either vaginally or to your genitalia or to your skin. And that mimics delivery when your ovaries used to function the way they should have. All right? Now, I'm getting back to SHBG for just a minute, sex hormone binding globulin. It works out that if you put the hormones on your skin and you don't use a chemical estrogen, a really strong estrogen, like they do in the birth control pill patches or the birth control pill rings, et cetera, those chemical estrogens still raise SHBG. And if you just use natural estrogens and natural testosterone, then it doesn't raise the amount of that protein in your blood, and you get real levels of those hormones in your body. So you don't want your SHBG to be super, super high. One of the reasons that birth control pills get rid of acne, okay, women go on birth control pills just to get rid of acne, is because it raises that protein, lowers your testosterone levels, okay, but it's a big price to pay. It does all kinds of bad things to your system over time. So that's a little bit of background. The best way to take testosterone is going to be topically, either vaginally or on your skin. But what kind of woman's going to be interested in taking testosterone? What kind of symptoms do you have if you're low on testosterone? Fatigue. Top of the list is fatigue. Yeah. 24/7, you don't have the energy that you used to have. Period, end of story. Now that's also true if you don't have enough estrogen. So many women going into menopause all of a sudden find, I am exhausted all the time. No estrogen, well not no estrogen, but less estrogen, less testosterone. Okay? If you used to exercise and you felt good after you exercised, you got kind of a pump after you exercised, you were energized for a while after you exercised, and now you try to exercise and you are just wasted, you're exhausted, that's even more specific fatigue for low testosterone. Okay. Now, anybody sporting these bat wings that nobody likes? Okay, all right, that's lack of testosterone. Because you lose muscle tone, you lose muscle strength, you lose muscle bulk, and so everything gets saggy. You can look at your face, and sometimes you'll see it as early as age 35, because basically your testosterone, your estrogen, your progesterone, they all peak in our 20s when we're supposed to have kids. By age 35, all of those are beginning to go south. And women will say, my face is sagging. It's because the muscles are not as full as they used to be, and so the skin sags. Does that make sense? So, come right back to you. So you can see it happening to women. Also, losing hair on your body. If you lose hair in your armpits, in your pubic area, and this applies to men also. If you lose hair on your legs, and it's kind of like, oh, I don't have to shave anymore. you too may have testosterone deficiency. All right, what was your question?
My question is, if we take testosterone, if it's low,
Mm-hmm.
will the sagging and the muscle, the bat wings go away?
It
Or
depends.
plump up the face? Or?
It depends upon how quickly you recognize what's going on,
Okay.
okay? And you have to do something to build those muscles
Yeah.
back.
Right.
You can't just put the testosterone on, oh, look at that muscle growing.
Great,
No,
right?
No,
Okay.
it's testosterone plus exercise,
Okay.
okay? Now, it is true that most things do tend to sag some as we get older, so you're not gonna get back to where you were when you were in your 20s or your 30s. But it's amazing how much you can recover. A wonderful example of where I'll have women and they come in and they have urinary incontinence. Okay, they're leaking urine. Okay, they can't make it to the bathroom on time. If they sneeze, if they cough, they wet their pants and just so frustrated. They don't want to be on the drugs because it makes you constipated and dry mouth and your vision is blurred, et cetera, et cetera. I can put those women on testosterone and have them apply it right down there. And then have them do Kegels. And I've had some women who were continent within 1 week. So, testosterone plus the exercise is just critical if you want to enhance muscle function. And that's what's going on frequently with that kind of incontinence, stress incontinence. Okay. Testosterone, though, it's not just about the way you look. Okay? It's about the way you feel about yourself. Women who have real low testosterone all lifelong, frequently, they're scared a lot of the time. They don't feel confident. They don't feel secure. They don't feel like they can take care of themselves. The world is a dangerous place, and they're kind of waiting for the next shoe to drop. No? If you have low testosterone, you're going to want a man. Take care of me. And I like guys, okay? I'm not putting guys down. But I think it's important for women to feel strong, to feel safe, all on their own. It gives you confidence, it gives you courage. Now, estrogen and progesterone give you courage also when it comes to taking care of your children. Estrogen and progesterone help you, everybody get together, let's work together and work together as a group, okay? And let's take care of everybody. Okay, that's estrogen and progesterone in action. So it's real hard for me to understand why these women who are in their early 50s, where their estrogen and progesterone is basically going down, want to have children. It's kind of like, no, you're at the wrong time of your life. Your hormones are going the wrong direction. You're not going to have as much desire and to take care of those children because you don't have those nurturing. Your focus is outwards to take care of everybody when you have enough estrogen and progesterone. Testosterone is, it is my time, I've taken care of everybody else for 20 years, I'm going to do what I want to do, I want to have some fun, et cetera, et cetera. That's why you see women saying that in their 50s. Because their estrogen and progesterone has come down and, they're fed up with this stuff, You've learned to take care of yourself. I know I've done it for 30 years. Come on, you can do it now. But that's partly why that happens. Women who have sufficient amounts of testosterone, they can make a decision, they can go forward with it, they can handle life's challenges. If you don't have enough testosterone, then what happens is you are very indecisive. You can get kind of whiny, very uncertain of yourself, and you want help making decisions because you cannot make a decision and you cannot embrace the decision that you've made because you're just so uncertain. And as a result of that, women tend to get profoundly anxious because they don't know what the right answer is. And they lose that confidence that they used to have. So you can think of people that you know, women who have never had enough testosterone. They will tend to be very feminine looking, They'll have very, very soft features. Their skin will always be dry. They won't have a lot of hair on their bodies at all. They won't be muscular, very slender, slight women. They haven't been athletes. And kind of, they enjoy singing in church. They enjoy taking care of kids. And I'm not putting them down, but you can recognize them, okay? And it's because they haven't had a whole lot of testosterone on board, right? And vive la difference, okay? I mean, we need all different kinds. It's not that one is better than another. I'm just giving you examples. Let me see. This is a wonderful book. It is by an OB-GYN by the name of Uzi Rice, R-E-I-S-S. I don't know if he's still alive or not. This was published in about 2001, I believe. And it's basically a Bible about, this is how to take bioidentical hormones. And some of the stuff that he puts in here is dated, but it's still, I mean, I always go back to it. And I learned several things that we will talk about tonight. Stamina is better if you have enough testosterone. You lose body fat. If you don't have enough testosterone, you will never, ever get buff, okay? You will always be kind of doughy, okay? You can't get lean with, no matter how much exercise you do. Stronger bones, feel secure, positive, and stable. Oh, sex. Increased libido, increased ability to have an orgasm, enhanced emotional aspect of sexuality. You know, so you get into it, you enjoy it. And it does, there's no question that testosterone reduces the rapidity with which you get plaques in your blood vessels. So it keeps your arteries younger, both by slowing down plaque formation and by making nitric oxide, which helps your arteries dilate, which gets the blood to the muscles when you exercise. Okay, and significantly improved balance and hand-eye coordination. So all of that is having sufficient amounts of testosterone. Make sense? Let me see. Signs of deficiency: flabbiness, weakness, loss of hair, loss of energy, poor balance, poor coordination. I can't make my mind up about anything. I don't care about sex. Not liking your body, and then loss of hair. So questions about symptoms that women have if they don't have enough testosterone.
I was just gonna ask you this, does that apply to both men and women?
Most of that
low
apply.
levels?
Absolutely. I mean, that's why there's, you know, I mean, so many men are on testosterone now. You know, we think about, oh, if he has trouble getting an erection, then he needs testosterone. But if a man is not as decisive as he used to be, and the way I describe for men is slightly different, but it really applies both to women. If you find that life is just overwhelming, and you would much rather just stay home and watch movies and not be involved in the world, for guys, not doing manly type things, okay? You know, get somebody else to you know, lose interest in hunting, lose interest in just pulling back from the world, whether it's a man or a woman. That's lack of testosterone. Okay. Also, they're not going to have as strong orgasms. They're not going to be interested in sex. One of the differences between men and women is that because the guy's the one who has to get the erection, okay, he can tell and you can tell very quickly if things are not working. And so one of the problems with men who have low testosterone is that they fail. Okay, they can't maintain that erection long enough to satisfy either themselves or to satisfy you. And so frequently they'll say, I'm not interested. They'll pick a fight. They would rather have a fight, they would rather not have sex than fail. You agree? Yep. He's just thinking about it. But something to ponder, because It's a pattern that I see so very often with men, and it's so easily fixable. So you get your man back. Okay, so the main place that testosterone is made in a woman's body, okay, are her ovaries. So if you have either your ovaries taken out or your ovaries and your uterus taken out, your testosterone levels are just going to plummet. All right. A conventional doctor is going to say, here, I'll give you some estrogen. They might give you an estrogen patch, okay? They're never going to give you progesterone. Read my article about why you want to be on progesterone if you had a hysterectomy, because it's good for the other trillion some cells in your body. It's not just for your uterus. And testosterone is important too, okay?